Hey, so some of you have requested a video going through cardiac embryology, and before I get into that, I would like to just briefly review some of the adult structures on the heart, just so when we go through cardiac embryology, I don't feel like I need to explain different structures to you. It'll just make it a little bit easier, okay? So let's start by getting oriented. That's the first thing you should always do. We have our superior border of the heart, our right border, left border, an inferior border. The inferior border is going to lead to the apex of the heart, okay? When I talk about blood flow or anything to do with the cardiac system, I always go through the heart in the same order. If you have a lot of things to learn, always try to study them in the same group or order because I promise it'll make it easier, okay? So, I'm a red blood cell in the foot. How am I going to get back to the heart? That's right, I'm going to go through the inferior vena cava. Inferior vena cava. I have a twin sister named Kate, and she's a little bit smarter than I am, so she's been hanging out in the brain. Where's she returning from? Superior vena cava. Nailed it. Superior vena cava. This one. That one. The superior and inferior vena cava are both dumping into what area? The right atrium. Okay. We also have a right auricle on our right atrium. Let's open this atrium up and take a look at it. Let's also scroll down my notes. Our right atrium has a smooth posterior wall and a rough anterior wall. It's not very well shown in this model, but you can see these rough lines in the anterior wall and the auricle. These rough structures have a special name. They're called the pectinate muscles, okay? When we get into embryology, it'll be important that one is rough and one is smooth, so remember it, all right? From our right atrium, we are going to move into our right ventricle via what structure? The atrioventricular valve. This is also known as the tricuspid valve because you always want to try before you buy, okay? We can see that the right ventricle also has rough walls, but they look a little bit different from our atrium. These are Dr. Buterick's metal band, the carnae trabeculae, aka the meat struts. We can see a finger-like projection right here. This is known as a papillary muscle, and it's holding on to some strings, some heartstrings. These are our chordae tendineae, and they attach to the valve. Good? In order to leave the ventricle, I'm going to have to go through this section right here. Do you see how we don't have any carnae trabeculae right before this valve? This area is known as our smooth outflow, okay? Another keyword, smooth outflow. We're going to go through the semilunar valve, and then what? What is this? It's our pulmonary arteries, okay? Not veins, pulmonary arteries. Let's pretend that we've now gone through the lungs, gotten some oxygen, and we're going to be coming back to our left atrium. So here we have our pulmonary veins, aka the little Shrek ears on the back of your heart, coming to our left atrium. Again, we have a left auricle, just like on the right side. However, if we open this up, we can see that our left auricle is entirely smooth, except for that little tiny auricle. Let's see if we can get it to focus on that. The auricle is the only place with what kind of muscle? Pectinate muscles, all right? Again, we're going to get from our atria to our ventricles via the atrioventricular valve. On the left side, it's also known as the bicuspid valve because you want to try before you buy, all right? The setup of your left ventricle is quite similar to that of the right. We again have our metal band, the trabeculae carnae. We have more papillary muscles with heartstrings, our chordae tendineae. And it's very difficult to see on this model, But there is another smooth outflow portion before our semilunar valves. Okay, smooth outflow valves. Now we're going to go to the aorta. This is just kind of like a quick side note. If you know your ABCs, then you know the branches of the aorta. So we have A for ascending aorta, B for brachiocephalic, left common carotid, and then left subclavian. So A, B, C, S, ABCs. If we have a left subclavian and carotid, we also want to have a right subclavian and carotid. But where are those coming from? They're coming from this brachiocephalic trunk, which we call brachiocephalic because brachio means arm, aka your subclavian, and cephalic means head, aka the carotid. So that pretty much sums up the adult structures except for the coronary system, which we can cover quite quickly. Here is your aorta. Your coronary arteries, you only have 2 of them, are both coming off of the aorta. You have a right coronary artery and a left coronary artery. We'll start with the right one. The right coronary artery is coming off in a groove between your atria and your ventricle. That groove is aptly named the atrioventricular groove. Okay? It's heading towards the bottom of the heart. And as it moves, it's going to send off a branch, and this will be our marginal branch. All right? The right coronary artery will continue towards the back of the heart and descend. What are these 2 structures? These are our ventricles. So if I have a blood vessel between our 2 ventricles, I'm probably going to call it my interventricular artery. But we want to be a little more specific, so we're going to call it our posterior interventricular artery. Since this posterior interventricular artery is coming off of the right coronary, we're going to call this a right-dominated heart. This is the most common presentation. However, sometimes you'll see your posterior interventricular coming off of the left coronary artery. This would then be a left-dominated heart. Okay? The left coronary artery is much shorter and it branches quite quickly. If we had a posterior interventricular artery, then we must also have an anterior interventricular artery. Okay? You can also call this the left anterior descending, aka the LAD. And that's the name that I prefer to call it. That's the name that I think most people prefer to call it. So this is your LAD coming off of the left coronary artery. The other branch of the left coronary is going to go underneath of your auricle and head around towards the back of the heart. This model doesn't really show it very well, but we're going to call it circumflex because it's traveling around the heart. Circumnavigate, circumlocution, circumflex. It's traveling around. This will eventually anastomose with this right branch, which was called posterior interventricular. Cool? The model, again, doesn't show it very well, but it should just be wrapping around in our atrioventricular groove to the posterior side. As for coronary veins, I promise they are not as hard as you've imagined. We're going to start with the right. So we had a right coronary artery coming to the inferior surface of our heart. This was called the what artery? The marginal artery. The vein that is paired with the marginal artery is the small cardiac vein. An easy way to remember this is that small populations are often marginalized because they're inferior, or they're seen as being inferior. Oh my God, don't misinterpret that. They're seen as being inferior. Okay, we're going to follow this right coronary artery around to the back of the heart where it's becoming our posterior interventricular, and it is paired with, do you guys know this one? The middle vein, middle cardiac vein. Another saying to help you remember this one would be that middle kids always have to sit in the back of the car, so middle is posterior. For our left coronary artery, we have this left anterior descending, our LAD, okay? And do Do you know what I like best about lads, about guys? I think they're great. So now we have the great coronary vein. Cool. All of these coronary veins are going to drain into this very large structure, which is our coronary sinus. The coronary sinus will then dump into, give me your best guess, the right atrium. Perfect. Nailed it. That's it for the adult heart. See you in the next video.